Welcome to Dr. David Klein, who today will talk to us about bad habits. Well, nobody has bad habits, Doc. Come on.
Well, the only bad habits are kind of an interesting thing. We are and have been our own worst enemies, and that's just the way things go. If given enough rope, we will all hang ourselves. Go ask Karl Marx. This is kind of the way this thing works. But what habits do we have that really are causing these little bits of damage to ourselves? Number one, okay, if you asked around, what's the worst habit anybody can have? The answer would be smoking.
Right.
What is it about smoking that is such a bad thing? You think it's just the fact that it diminishes your lung capacity? Is it so bad that it makes you stink? Is it so bad that it turns your teeth yellow? Is it so bad that it takes all the furnishings in your house and turns them into dinge, okay, long before their useful life is over? The answer is, nah, that's all okay. That's all remediable. That's not a big deal. The problem with cigarette smoking, okay, is that it causes the body to change in certain very predictable ways. And as you get older, these predictable changes have a tendency to come back and bite you. Okay, so now that you're getting a little bit older, we all have friends. We all have associates. We may actually be the friend or associate that needs a joint replacement, or that needs spinal surgery, or that needs breast augmentation, or that needs this surgery or that surgery. It's been long known, it's been long recognized that folks that are smokers, okay, have a decreased chance of doing well in surgery. And it's not just the anesthesia. We could talk about the anesthesia all day long. Okay, I've done general anesthetic for smokers well over, 10, 20,000 times. You can get people through the surgery, but it's the recovery that really causes damage. So you're going to go in for knee replacement as a smoker or somebody that's exposed to smoke products. Okay, the bone diminishes. You end up with weakening of the bone because the small blood vessels all constrict. If you don't see it, you don't believe it, look at your friend across the street, the heavy smoker. Look at this person's skin. Look at the wrinkles. Okay, look at the loss of skin turgor. Look at the color, the purplish tinge to their fingers and toes. Their feet may be bright purple. This is from the microvasculature not allowing the blood to pass through it. Now, I want you to imagine slicing through that with a knife or a chisel in terms of bone. Okay, if the blood supply to the injured or surgerized area is inadequate, it does not heal. So when I was at Duke, okay, we would not operate on a person's spine elective surgery, if they were smokers. They were told to go home and come back when they were smoke-free. 6, 8, 12 weeks, because nobody wanted a bad result on their statistics. You will be judged by your scars. Now, Koch was the name of the surgeon that described that back in the 19th century. You will be judged by your scars. Actually, today we're judged by our statistics. Nobody wants bad results. So it's far easier to send somebody home and say, hey, why don't you go find some hack to take care of this, because you're likely to end up being the one that's going to need a second, third, or fourth surgery unless somebody advises you otherwise. So here's how it works. Smoking, miserable habit. Why? Not just because of the emphysema, not just because of the chronic bronchitis, not just because of the Berger's disease, not just because of the Alzheimer's, not just because of the atherosclerosis, not just because of the aortic aneurysms that happen. They never happened, by the way, in people that didn't smoke, but because of the fact that it decreases the likelihood of satisfactory recovery. That is the way it goes. It's like trying to cut into wet drywall. It doesn't work. What about alcohol? Okay, alcohol is a poison. We all consume this poison at one level or another. There are people out there that are teetotalers. That's fine. You're still consuming alcohol, whether you know it or not, in your medications, in your foods. Things that contain alcohol. It is a naturally occurring substance. But in excess, okay, it causes difficulties with regards to liver metabolism and kidney metabolism. Alcohol is a major, major problem with regards to diabetes, the immune system, development of dementia. So you need to look at this very, very hard. Okay, it's a social issue as well as a medical issue. How much is sufficient? Your body has the capacity to safely detoxify 1 ounce per hour. What's a safe amount to take per day? Between 1 and 2 ounces. You start exceeding that, you're going to start having damage over time. What about coffee? A problem near and dear to my heart, having been a recovering caffeine addict. I was drinking 28 cups a day and sleeping adequately. I could drink a pot of coffee, that's 10 cups, and go to sleep. because my body had adapted to it. Caffeine, marvelous stuff. It makes you feel like $1,000,000. Back, I think it was before the 1500s, you could, if you were a Catholic and you were caught drinking caffeine, you would be excommunicated. Why? Because the Turks invented it. There was an issue with the church and the Turks. They did not get along. They were at war for hundreds of years. It wasn't until, I can't remember which pope it was, discovered the benefits of caffeine, subsequently became addicted to it, that it became okay. Caffeine, okay, yellows the teeth. It causes issue with regards to peptic ulcer disease, so on and so forth. So everything in moderation, caffeine notwithstanding. Now comes a big one, and that's sugar.
Yep.
Now, we are sugar consumers of a remarkable nature. What exactly does granulated sugar do for us, or do to us more appropriately, that causes us damage? Granular sugar is present in all or nearly all prepared foods, but it's a guarantee to cause your body to become resistant to insulin, which is another way of saying type 2 diabetes. It doesn't take long for this to occur. It can a matter of a few weeks. Taking sufficient fructose, it will jack your insulin level up and your blood sugar will follow. So sugar is poison. Absolutely true. You need to cut that stuff out of your diet. What little you can do, go for it. It's something that you can do. You're fully empowered to it. And wouldn't you know it, okay, that when tested in the rat model, which is the same as the human, fructose, table sugar, is more addictive than cocaine. So if you believe this is any different, try to eat one of those Fritos corn chips. Okay, I bet you can't eat just one because it's just about correct. You can't. Okay, you will go right at it and off you go. What else can you influence? Sleep. Okay, sleep is terribly important with regards to maintaining your body's ability to fight infection, growth, and other sorts of things like mental illness. If you want to cause somebody to become depressed, you deprive them of sleep. 3 or 4 days, they become irritable, very, very irritable. After a few weeks, they become depressed. After 6 to 12 weeks, it can become irreversible depression, clinical depression. Sleep is necessary for mental health. How much sleep do you need? It changes throughout life. It starts off at 10 to 10 and a half hours, and it ends up at 10 and 10 and a half hours. Guess what? The fact that you're not sleeping as much as you did when you were a kid doesn't mean your body doesn't need it. It means something biological is changing, and it needs to change, or you too are going to get ill. Now, what about drugs? Okay, you think they do you any good? This is your brain. This is your brain on drugs. No kidding. Okay, we don't need to get into hard drugs to really understand how these things work. My favorite one right now is marijuana. Okay, if you want to take away somebody's ability to focus, maintain, and get the job done, go ahead and give them medical marijuana. That's a great idea. Well, it helps with pain, it helps with this, it helps with that, which explains every bit of why these folks that use marijuana on a regular basis still need their pain medications, still need their antidepressants, they still need every bit of medication that's being given to them, but they just don't seem to care as much. God bless them. Not me, not for my family, because the stuff is poison.
Bad habits are hard to break.
Bad habits can be impossible to break, but there's only one person that can break a bad habit, and that's the person that has the bad habit. When do you start? You start now. If I can come off of caffeine at 28 cups, okay, you can also. You have to do that which you have to do.
Do we feel like inositol had anything to do with helping you get off of coffee?
You're giving away the secret sauce.
Sorry.
What I did, okay, I discovered something interesting about automatic behavior, and it was with a complex carbohydrate called inositol. Inositol is an interesting one. This stuff is inexpensive. They use it as a non-glucose sweetener. Inositol is interesting. It cuts back your willingness, your need for caffeine. It cuts back in your willingness or need for tobacco, alcohol, as well as other drugs. So I use it for cocaine addiction as well. N-acetylcysteine will do the same thing with cocaine addicts. Very, very interesting. Inositol is also a primary antidepressant. I don't think that it's any great surprise that this would happen. Yeah, it was a surprise to me when I came off the caffeine because I couldn't do it any other way. It was just a matter of serendipity. I started experimenting with inositol for another process. And wouldn't you know it, the coffee stayed in the pot.
There you go. Inositol, one of the many items you'll find at the stages of life in the nutraceutical store. And get this, you don't have to go there to buy it. You can have all of your nutraceuticals shipped to you right to your front door on a timely basis so you don't run out. You set up your own plan. It's wonderful. How? StagesOfLifeVitamins.com, StagesOfLifeVitamins.com. And don't forget, you want to know more about the doctor, about the practice, SufferNoMore.com, SufferNoMore.com. Here's more contact information.
Our phone number is 407-679-3337, and our website is stagesoflife.net. We're located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And let's see, our office hours are Monday through Thursday, 8 to 5. The health store that Rob mentioned with all of our nutraceuticals is open during those office hours, but we're also on the web, as I said, at stagesoflife.net, and you can purchase your nutraceuticals at your leisure, and we will ship them to you. We'll ship them to you.